Hi to everyone who's joining us today for another Totara community webinar. Thank you so much for spending your Wednesday afternoon with us or your Wednesday mornings. It's great to have you all here. The idea for these sessions is that we go behind the scenes with someone who's usually a site administrator or a course creator, someone who's doing a lot of work in their Totara platforms, so that you can come along, you can see what people are doing. You can also see any improvements they've made to their platforms, and you can ask questions as well. So if you're trying to do something on your own Totara platform and you'd like to see how someone else is doing that, you can go behind the scenes and have a look. And that's really the idea for these sessions. Adam, would you mind moving to the next slide for me?
Yeah.
And so just to say, this session is being recorded, so you don't have to screenshot everything. We will send you the webinar afterwards. If you do have further questions, we will put the recording in the Totara community. So if you do have questions outside of this webinar, you're very welcome to ask those questions in the community, and we can come back to you. Can there's the next one. So if you have managed to find this webinar today without joining the Totara community, well done. We tend to promote a lot of things through the community. So the community is a one-stop shop really to learn everything about Totara. So if you do have a Totara site and you're not a member of the Totara community, I would really strongly recommend joining the Totara community. We have a large academy, there's lots of free training where you can learn about how to manage your platform. So do come and have a look. If anyone wants a tour at any time, I'm very happy to show people around as well. There's lots on there. If you can move to the next slide, please, Anne. So just a very quick note about Totara. So Totara is predominantly an LMS. You can learn more about Totara at totara.com. But Totara works predominantly with partners all over the world. And today we're joined by one of our strongest platinum partners. It's also part of the Totara organization now, which is Think. And we've got Peter along with us today to just give us an introduction to Think as well. So we will have a small introduction to Think as Circle Health Group and Think work really closely together to produce their incredible platform, which has won many awards now as well. If you can move to the next slide, please, Adam. Great. So yeah, Adam, it would be great to have an introduction to you first, Adam, but then also to understand more about Circle Health Group.
Cool. Yeah. So my name's Adam Harvey. I am Digital Learning Manager for Circle Health Group. I work in our wider HR team as part of the people development team, which is a team of around 20 people encompassing L&D, talent and operations, clinical education, and talent leadership and management kind of training as well. And Circle Health Group is the largest network of private hospitals and healthcare in the UK. It fills across 54 or 54 plus hospitals now. And we've got around 9,000 contracted staff, and that expands up to close to 13 or 14,000 when you include bank and agency staff. So we've got some of the kind of indicatives of the company and this company size. And as you can imagine, with 54 hospitals, we are nationwide. So from close to me down in Devon in Bath, which isn't that close to me, to be honest, all the way up to the kind of far reaches of Scotland. So we are all over the country. And yeah, Circle have, when you join Circle, you're told a lot about the Circle philosophy, which is our purpose of providing high quality, safe, compassionate care for patients, or for what they need and expect as patients. And then that splits down into principles. And you can see we believe in our people as one of the core principles, and that's very much where our team and the wider people development team come in and help with that internally within the company. And then we have values of being selfless and compassionate, collaborative and committed, agile and brave, and tenacious and creative. So the company, all through the business, live and breathe these principles and values, but very much so in the work that we do in people development. That's just a very quick overview of who Circle are. I'm going to hand over to Peter to introduce Think Learning.
Thanks, Adam. Hi everyone, so my name's Peter Holmes. I'm the Professional Services Team Leader at Think Learning. As Matt already mentioned, we are or were a Totara partner and Totara reseller who's now become part of the Totara family. So we're essentially just a team of LMS and Totara experts. We've got a big team of solution consultants, implementation consultants, customer relationship managers, support consultants, and an in-house team of developers as well, and sysadmins. So we've got a well-rounded team of experts that support our Totara clients to unlock the potential of Totara and to achieve with it what they need to. My team, the professional services team, we focus on project-based work. So it's new implementations of Totaras or building custom solutions. So a big part of what we do is developing new functionality to meet client need. And that's part of what we do with Adam and the team at Circle. For example, at the moment, I'm working with Adam on a new theming and UX project to spruce up the look and feel of their platform. So what we do is we work with clients to deliver Totaras, but we also build custom solutions. So we've over time created our own code base and plugin library that's built on top of the Totara code base, so we can provide additional features to all of our clients, essentially. So here's some of the examples of people that we serve. So we are an award-winning supplier with lots of NHS clients. One of our focuses is healthcare, including private healthcare like Circle. But we also have hospitality clients like Mitchells and Butler, the Law Society, the Government Commercial College, which is part of the Cabinet Office, and many other large clients like that. If you've got any questions or would like any more info about how we can help, please do get in touch. But I'll hand it back over to Adam for the rest of the seminar.
Cool, thank you very much. So so I've been with Circle now for 3.5, close to 4 years, and since I've joined, they've always been partnered with Think. And one of the things that struck me when I first joined was just how strong that relationship was already was between the teams that worked for Circle and the internal team to Think. And I think like over the last couple of years, we've really built on that as well. So we've worked on a series of projects from very small, almost kind of invisible changes to the back end up to working on getting the events calendar and booking calendars to show to staff across the business. So we've done very small, very large projects, and we've got a really good understanding between the teams, how the teams work together. We know what we're expected to do and supply to Think, and Think vice versa know what we are expecting them to do. And it just works really well. And it's led this last kind of 6 to 12 months in getting a Totara highly commended project award, which was greatly received. And we also won an external award for getting a bronze medal for Learning Platform of the Year at the Learning Awards that was held in London in February. So when I joined, Circle and Think were already quite a way down the road on what change they were needing to do to get the LMS and largely the learning and development portfolio for the business our size ready. So they had initially, before partnering with Think, they had a very kind of standard tick and click compliance thing. The sites held a lot of data at site level. A lot of it was paper based. So a lot of the digital and online footprint was the bare minimum and what was necessary for compliance. And through the vision of my manager and his manager, so Kevin Avis and Jenny McKnight's vision, they saw the learning space, or which is what we call our LMS, as being able to kind of really drive development and change within the business. And they changed the focus from just compliance into as well as compliance, relying on continuous professional development, bring in intelligent information and insight to the wider business, and focus more on what was wanted and needed from senior management and staff at the ground level, and have built a platform that I think as a team we're really proud of, and we're excited to take it to the next level. So one of the first things that we focused on was how essentially the learning space integrates within our wider systems. So we've got, as a company, as a healthcare company, you'd imagine we've got a lot of separate systems that all kind of need to talk to each other. And the two, so we wanted these to connect, that information to be simplified for the end user and for it to be able to support the needs of the business. And that takes us from our HR system, which is Workday. So it's worth saying at this point that we've only recently in the last 2 years moved to Workday. So we were a very established LMS before we moved from iTrent to Workday. So although Workday do have some form of LMS, the decision was made that we would stick with Totara because it was more than meeting the needs of what we needed it to do in the day-to-day use of our system. So instead of that, we use Workday as our kind of staff information system. And then we also have our IT systems, which contain staff information for their emails, etc. And they combine to produce a profile on Learning Space. And then Learning Space essentially looks at who you are, where you work, what your role is within the business, and then it allocates you training based on these predetermined things. And we've done that through the use of dynamic audiences in the back end of Totara. So a lot of it will be fully automated. So we try and create essentially a blanket that covers 95% of staff training requirements based on information from IT and Workday. And then we allow, through the use of custom fields in the profile, for nuance on site. So some sites will have specialist requirements for, say, like a healthcare assistant would be expected to do an additional role on a smaller site than it would be on a larger site. And so we've built this Learning Space to allow for that to kind of be kind of built into the system and have that flex, and allows us to kind of really kind of give the right training to the right person easily. And then with the training complete, we're able to produce a set of data that incorporates kind of use data and preemptive modeling, which I will touch on a bit later, but it also kind of points to compliance across the sites. And we can do that both internally with the reports that Learning Space do, but we also use the data sets that we generate from Learning Space to produce more in-depth Power BI reporting. And I'm going to show you some still images of that later on, because I can't show you it live because of all the personal data. And then we wanted, the main use of the Learning Space is mandatory and role-specific compliance training. So we wanted that again to be simpler for that end user. What do I need to do? When do I need to do it? Faster, so they're not having to search around for the courses they need to do. It's there front and center for them to kind of complete. And then we want it unified. So again, talking about the audiences, we want those sites to be able to reliably know that their staff are doing the training that they need them to do. And so our platform looks like this. Hopefully you can still see that, and I've not mucked up my screen sharing. So this is the home page. Thank you very much. It looks very blue, doesn't it? So we have a standard home page that kind of pushes more of the personal development side. So we run very successful masterclasses across different elements of leadership and management, clinical specialities. We've got Think's coaching and mentoring platform embedded into the Learning Space now, and that's We've had that now for 3 or 4 months, and it is starting to show kind of traction within the business. And then we've got a few kind of resources that link out to one of our partnerships with Get Abstract. But in terms of training, they have, every member of staff has their learning certificates presented to them in a radial format, and they can move between different filters. As you will not be surprised, constantly on Learning Space, so I'm 100% compliant in everything. But if this was to show, this would show courses that were due, courses that had expired, and courses that have been newly assigned. And then I also have a dashboard at the top of how well I'm doing with my competencies, when my next appraisal is due, whether I've got any upcoming bookings on the system. And then, as if by magic, I'm going to switch to a dummy user who's got all their compliances. So we've used the behavior system within Totara to create competencies that staff can self-assign, rate, and then monitor kind of as a live document rather than traditionally it being paper-based on site. So we've got them at the moment as self-assigned, or their managers can assign them. And through kind of upcoming developments with Think, this is going to be embedded in an appraisal process, an appraisal workflow, along with goal setting, along with kind of external training requests, and it all be a lot more kind of harmonious in kind of that development of staff. What we also do is, and what we've been really successful with, is in things like IPC, so infection prevention control, and ANTT, which is another form of infection prevention, which what it stands for escapes me momentarily. We have to have a requirement for sites to witness competency, so it can't be just a tick box exercise done digitally. But what we were finding was that when sites were managing that and storing that in lots of different ways, so what we've done using the assignment activity within the learning space is create essentially submission points for all that documentation to be uploaded and stored into a centralized place, which then the kind of company head of IPC and ANTT can dip check and get access to those certificates without the need to go through 3 or 4 emails and request certain people. All the information is there, accessible to them as and when they need it. So that's actually led to Circle being given gold accreditation for ANTT, which I believe we're the first private healthcare company to achieve that in the UK. And largely that has been made possible through the use of Totara as the LMS. So I think Matt's going to share or make the presentation available after. So there's some example images of what the competency looks like. And then we want the next kind of strand of what we want the learning space to be is that a place that inspires development and personal development. So you want training to be realistic, you want it to be achievable, and where possible, we want it to be accredited. So again, we've partnered with ILM, Liverpool John Moores University, Teesside University to create courses that you can only do through Circle. And they are available to Circle staff through essentially booking on through the learning space. So if we go back to our page, we've got dashboards for both clinical and leadership that show like pathways through. So for example, you could start with Circle as a healthcare assistant, and through using the pathways that we've created within the people development team, you could end up achieving your master's level qualification, moving through the company, changing your role, becoming a registered nurse, an operating department practitioner, do your radiology degree, anything that you want to achieve, you should be able to achieve with the business, within the business. And equally, we want to grow our own managers, so there's a whole kind of pathway from that introduction to you first becoming a manager all the way through to becoming a senior leader and doing an MBA towards outstanding. And the latest course that they've done is a hospital leadership degree or MBA qualification that's like the first in the country for that. So there's again some images, and we want the platform to be relevant, navigatable, and useful to staff. So the introduction of that dashboard or that homepage where they can see bite-sized pieces of learning, things that will inspire and engage with them. So the masterclasses, which have proved hugely successful across a variety of different kind of threads and genres, and then the coaching and mentoring platform, everything is there gauged around the support and the development of our own staff. So we've got a couple of images here. So there's the coaching and mentoring hub. So the coaching and mentoring hub is double-sided, so you can be in that hub as someone that's requiring coaching and mentoring. But we've also built a workflow, whereas if you wanted to be a coach or a mentor, you could apply through Learning Space to be that. You're reviewed by a member of the team. You're given access to be the coach and the mentor, and then through Think Link, which I believe is the technical name of the coaching and mentoring system, you can partner up and people can find you as a coach that they want to be coached by or mentored by. So at the moment we're doing it as coaching and mentoring, but the plan is possibly to do it as a redesigned buddy system. So when people start with Circle, they're often given a buddy to take them through that induction journey. And that's always kind of been done kind of outside of any system. It's all been done through emails and manually booking. But we think we can build off of the work that we've done with the coaching and mentoring and embed that into the induction period process directly through Learning Space. How are we doing for time? I'm just conscious that I'm probably rambling quite a bit. And the final thing that we've done, especially in the last kind of year and a half, is we noticed that we were being asked for more and more data from different sources. So SMT, hospitals, the wider SMT for the entire business, wanted different sets of data in different ways, and they wanted to be able to interrogate it. We needed to know that the data was correct, so we need it to come from our system rather than come from sites indirectly, and we needed it to be insightful. So the first thing that we've done is essentially put all of that compliance data into a Power BI. And so obviously this would normally have a list of hospital names, but we've blanked that out for GDPR reasons. But here at a top level, the CEO of the business could go in and see a breakdown of company-wide compliance, region compliance, hospital compliance, and within 2 or 3 more clicks could be down at a departmental or an individual level. The amount of data in that Power BI is incredible. And so we can see where there are areas that are failing, where there are areas that can be improved. And then we've built on that and we've added the appraisal information so that can also be tracked. Eventually, we probably have the competencies added as well. And that's given the trust in the business that they can rely on our LMS as a source of reliable data. about 12 months ago, we made the decision, as we were getting asked for more and more data and more complex data, we made a decision to hire a data analyst within the team. And so we've got an amazing data analyst called Anna, who understands data far more than anyone else in the team, and she is able to see things that we weren't able to see before. So we were looking at how we managed our face-to-face workshop training, and we were finding that some sessions were being underutilized but being run with maybe one or two people, whereas someone at another site in London was also at the same time running a same workshop with the same number of people, and they could have been combined. And so she's able, I'm not really explaining this very well, but it's very clever. So using our due dates and the visualization, we can now see what the need for certain workshops will be in different regions of the business, so different clusters. And then we can align and book extra or run extra courses, remove courses that we don't think won't be oversubscribed. And so we're able to produce back to the business a real kind of cost saving, because we're able to use the data that the LMS is generating to predict where our kind of training needs are going to be. And so we're still finessing that and trialing that perfect to get it perfect before we start using it in real anger, but it's there and it's working, and it looks like something that's really going to kind of be useful moving forward. And then what's next? So Pete's touched on it already. We're in the process of retheming the whole of learning space in preparation to go to version 19 towards the end of the summer, early autumn maybe. We've also got some work on a new appraisals workflow that will embed the competencies, be easier to see their training records in one kind of fluid kind of workflow rather than having to have 3 or 4 pages open. And then we're doing a lot of work around advanced analytics. So we're looking at how those questions that, for example, are answered in your appraisal. So what are you looking to achieve? What are you looking to do in the next year? That we'll be able to take that data out of the learning space and then use, we've got all the way half an hour in without using the word, but we might be able to use AI to look at it and analyze where are there trends at certain sites in certain regions or company-wide of what training and what people are looking to do and achieve within Circle. And then that will help us build and design courses and training for those needs rather than build the training and hope that people want to do it. But yeah, that is all my presentation.
Thanks, Adam, for running us through that. Yeah, if anyone has any questions for Adam at all, feel free to jump in there. Yeah, big shout out to your data analyst, Anna, as well. It's a lot of interesting work that you're sharing there, just to pinpoint exactly which training sessions you need and which ones you don't need. I mean, all the data's in there, but yeah, being able to like analyze it and look at it with a sort of microscope is a really good idea. Does anyone have any questions for Adam at all? So we've just getting comments. Great presentation. There you go, Adam.
We have all those comments.
You've got an A star, so that's good. If anyone does have any questions, feel free to jump in. Or for Pete as well, or for Peter, sorry, feel free to just ask any questions. Otherwise, I would say thanks so much, Adam, for taking us behind the scenes and for showcasing exactly what you're doing at Circle Health Group. Quick question is, do you measure effectiveness using your data? So how do you measure effectiveness as well, I suppose?
So at the moment, if we've got kind of different allocations of training. So if you work in the people development team, we've set up the feedback seminar, the seminar feedback tool. to ask you a set of questions, and then we like that, as you'd imagine, we go to Anna, and Anna visualizes that for us. So we track that internally within our team, and we're at the point where we're just about to kind of open that up to all our trainers within Circle, so site-based trainers as well. And as a facilitator, you'd be able to see your direct feedback, but you wouldn't be able to see anyone else's. But a manager or a training lead would be able to see everyone that kind of sits under them. And so we've trialed that, and we've now also got the ability to run those kind of feedback surveys off activity and course completion, not just feedback, not just seminars and workshops now. So the next stage is to start to kind of build that around probably first on master classes, and then develop it further into kind of it randomly sending, look, rather than every time you complete a course, it sends you the feedback, that it picks people at random and it captures kind of a snapshot of how people are finding training. But again, that's all something that is in Totara, or is in Think's version of Totara, and is fully feature rich now. So you can write different types of seminar, different styles of questions. It's really helpful. It's been really useful, kind of developing our face-to-face sessions, and I think it'll do the same for our kind of online or blended learning sessions as well.
Adam, another question from Oscar is just asking, well, first of all, he gave a comment, which is really enjoyed the presentation, so very insightful. So another A star there. I don't do A stars anymore, do we? That's showing my age there. It's numbers now, isn't
It's
it?
weird. It's like 9.
It's
You're
9,
like,
yeah,
oh,
so you give us a 9. So Oscar's asking, has there been any interesting or unexpected trends that you found with your data so far?
No, not so much. So like the core kind of data is around that compliance. So we've had issues where, or not so much issues, but areas where it's not matched with our suppliers. So if you work in healthcare, Oscar, you know a lot of the training needs to be kind of mapped against the clinical skills framework. So we have that kind of externally supplied to us through a company, and then they send us their kind of data feed of the access of those like kind of SCORM packages, and then they've sometimes not aligned directly with our kind of compliance records, and we found that that's largely because like we're taking slightly different data. So they're presenting data in one way and we're presenting data in another way, and so kind of understanding how those align and kind of clearing that up has been kind of as close to kind of any issues we've had. And just the normal kind of Power BI Microsoft issues where something gets updated or changed and no one's aware that it's updated or changed until you get kind of service desk emails saying, why is this not showing what we think it should be showing on site? And that's a lot because we give people on site access to the reporting direct from Learning Space as well. They can kind of cross-reference and double check. So we're confident enough in the data that Learning Space is producing that we give them the ability to cross-check their own data rather than us constantly doing it for them. Any financial measures, right?
Yeah, so Magda's question, which everyone can't see, is just are there any financial measures like ROI or KPIs, etc., that you measure as well?
So I think like with the data around kind of the seminars and face-to-face training, that will begin to kind of produce kind of return on investment stats. So we know that we're doing the most kind of streamlined version of that. In terms of KPI, for internal, from what it does for our team, no, not so much. But the appraisal system, the new appraisal system, will allow kind of KPIs and goal setting for all staff as part of their kind of yearly appraisal system. So hope that answers your question. If it doesn't, like ask again, and I'll try again.
Very great, thank you. Okay, Joe, I can see your hands up. That might be accidental. But if you've got your hand up, you're very welcome to ask a question. But yeah, thanks so much, Adam, and thanks, Peter, for taking us behind the scenes. Adam, I would say as well that is an incredible site admin and very knowledgeable about Totara and has been taking me all behind the scenes with certifications recently as well, just to look how we can further improve Totara going forward. So thanks very much, Adam, for basically being a wonderful member of the community as well and showcasing all this to us today. It's been great to see. So if anyone does have further questions in the future, feel free to ask, and I'm sure Adam would be happy to say something to you as well.
Yeah. Or if there's something that's you want to see a demo of something that's a bit more complicated than just kind of a quick question in a chat box, reach out to Matt, and Matt can reach out and we can arrange a time to look at something in more detail.
Thanks, Adam. Okay, well, thanks so much for today, and thanks everyone for joining us. I think we'll close it up there. But yeah, it's been great to go behind the scenes again, Adam, and I really appreciate your time.
Thank you very much.
Thanks everyone for joining us today, and thanks Peter as well. I think I muted Peter. Thanks, Peter.
You muted me, yeah. Thank you. Thanks everyone, and thanks Adam. That's great.
Cool.
Thanks.
Thank you.
We'll finish there.
Cheers,
Everyone's just saying thanks very much, Adam. So yeah, thank you. Great presentation. Thank you, and great insights. So thanks a lot. We'll
Cool.
finish there for today. Thanks, everyone. Bye.
Cheers. Bye.
Bye.